approximately 2 years ago, as an organization, we began researching the potential for being nominated as a patient-centered medical home through Blue Cross Blue Shield of Michigan. The application was accepted, and we began in earnest to prepare for a survey that took place a year ago, May.
Blue Cross has a rigorous survey that they go through for patient-centered medical home. We had a significant number of the policies and processes in place, so we were already working as a team to take care of patients. We had to use Energy EHR to be able to verify for Blue Cross that we had the ability to measure outcomes, and that, again, SAGE would help us in the future develop applications that would make it easier for us to obtain and report that information.
We're very reliant upon the solutions offered through SAGE Energy, in that we use practice analytics for providing reports and data for us to perform performance improvement activities.
We're able to capture data for our diabetes, and all of the national patient safety goals have some metric attached to them. So through auditing and using practice analytics to report metrics, we're able to meet all of the survey standards.
Being able to track data from one visit to the last, and having it instantly available, so it's kind of nice. They come in for their diabetic recheck. I've got their A1C that's current in their current labs, but I've got all their last ones on quick recall. They're in our flow sheets. We can look at them all side by side. So you can get a snapshot of their last year, their last 2 years, their last 5 years, and really put it all together.
Patient-centered medical home puts the patient in the center. They are the ones that need to be the driving forces. They're the ones that need to go home and practice and do the things that are going to give them a healthier, longer life. So having them a part of the plan and interacting with the physician and the staff, asking questions so that they, number one, understand their disease. Our whole goal in that is to give them all the tools that they need at home to keep themselves healthy, so that they know when to call us. We want to be able to intervene with their disease condition before they get to the point where they have to go to the emergency room or be admitted.
We're able to drill down and starting to look at some clinical outcomes. We're able to expand our diabetes education program and management of our diabetes patients.
I think diabetes is a good example. I believe that we do a better job with diabetes because of our ability to use the flow sheet system within the EHR. Probably similarly, disease processes such as hyperlipidemia, chronic kidney disease, all of that's been easier because we put that data specifically into a place within the charting system called our flow sheet.
When you take a diabetic and you want to see what their glycohemoglobins are doing, the flow sheets is a quick stop to click on to see, okay, what is their glycohemoglobin doing? Is it going up? Is it going down? Are we hitting spikes, troughs? What are we actually doing over a span? So the longer the patient is with you and the longer you've been populating those flow sheets, you really get to see a good picture of what's going on with them.
There's a blood test that we use called the hemoglobin A1C, and I can pull it up on the flow sheet and show the patients the hemoglobin A1Cs side by side over the past several months, or actually the past several years even.
We have about 100 patients on insulin pumps. We want to know that they're getting their lab work done and various things that are going to help them be successful in managing their disease.
That's really patient-centered medical home. That's utilizing the chart the way it should be used. And it's nice because you can actually pull a graph up for the patient, and then they can actually visualize what's going on.
It definitely helps us to better care for our patients. It helps to demonstrate the extent of our commitment to quality care for our diabetic patients, just as an example.
The practice portal is a big part of our patient-centered medical home. It gives us the ability to keep in contact with our patients and for our patients to stay involved in their own care. When we went through the patient-centered medical home audit and we outlined the features that we had with the practice portal, the surveyors were very enthused about it, commented that it was one of the most fully featured portals that they had come across in all of their audits.
We're using the patient portal, which allows them easier access to their healthcare providers.
It's funny, I had the opportunity to address our local Commission on Aging group, and by far they were probably the most enthusiastic group that I've talked to about the portal. They were excited about the idea, the ability to keep in touch using a computer.
The technology, at least as we're using it, is great for, instant access to everything.
Communication is by far the biggest thing. They feel like they're more a part of the whole care process. They can communicate back and forth with their provider. They aren't waiting for someone to answer a phone. They can do it when it's convenient for them.
We use practice analytics very extensively to get us to prepare some of the queries and the reports that we used to get the data that we needed to present to Blue Cross Blue Shield for patient-centered medical home, and then also to Medicare and Medicaid services too for the Rural Health Clinic.
The Entergy program is designed for us to document those certain pieces, whether it's for HEDIS measures. They're measures that are geared more towards pay for performance with certain payers, meaningful use. All of those are now starting to kind of come together and intertwine. So what you're needing for one to accomplish HEDIS measures, for example, a lot of that information is the same as what's required for meaningful use and patient-centered medical home. So it's kind of nice that they're all coming together.
Meaningful use, it's one that we've struggled with initially is, how do you get meaningful use, but the system is actually doing a lot of it for us already in terms of being able to track all the things that we already can do and we already have been doing.
Meeting the requirements for meaningful use, I think, are important for the regulatory facilities, but in my view, what's really important is being able to identify the trends in patient care and use the system to make us provide better care for the patients. I believe that we're meeting the meaningful use by virtue of the way the program is put together, but more importantly, I think it's allowing us to give better care to our patients.
We have been able to utilize the system to make strategic decisions.
Practice analytics has been very beneficial to our practice. We've been able to make some very robust reports that we've been able to use for higher level management around the organization. It's been critical in our reporting for Rural Health Clinic and also for the patient-centered medical home.
We're utilizing the computer system every single day to be sure that we will be successful in the future.
And now I'm sure as we're going forward towards accountable care organizations and some of these other things that are coming into play as well, its ability to fine-tune and drill down and build ad hoc reports and also the regular monthly reports is very, very critical to our performance as an organization.
For those practices that are considering patient-centered medical home, they would need to take a step back and analyze their practice management system and their EHR to determine the amount of data that they'll be able to report on in the future.
You don't have to meet all the criteria first year out, you just have to show you're meeting such and such, and you're looking at these future goals. Especially for practices that maybe don't have an electronic system in line yet, it's showing proof that, okay, we're in discussion to get an EHR, we're in the process, or we've hired Sage or somebody else, to go in and look.
They need to look at their operating policies and whatever the governing body that's certifying for patient-centered medical home will have a list of what their expectations are. And so you need to go through those very carefully one at a time and kind of rate yourself to determine your own success rate.
From a PCMH perspective, we plan further designations, and with Blue Cross Blue Shield of Michigan, for example, a couple of things. We must reapply and be designated each year. We're finding that more health plans in the state are accepting the designation that we receive from Blue Cross Blue Shield in reciprocity. So it's helping us to achieve greater incentives and the recognition that we look for.